Now we're looking at respiratory tract infections that are going to affect both the upper and lower respiratory tracts. All right, so whooping cough, also known as pertussis, has a few different phases. The catarrhal phase, this is whenever there's bacteria in the upper respiratory tract, and it presents itself as the common cold. And then the paroxysmal phase, this is uncontrollable coughing. This is typically what you think about with whooping cough, that produces those whooping sounds. It's typically a result of broken blood vessels, or can result in broken blood vessels in the eyes, can lead to vomiting, even hemorrhaging in the brain. And then finally, the convalescent phase. This is where the bacteria are decreasing, but the ciliated epithelia in the respiratory tract have been damaged, and it can take weeks or months to recover after the infection, and after the bacteria has been removed. The causative agent is Bordetella pertussis. It's a small gram-negative rod, strictly aerobic and fastidious. It does have filamentous hemagglutinin that's essential for it to attach. Most of its damage is caused by a toxin called the pertussis toxin that causes massive mucus secretion that leads to the coughing of trying to get rid of that mucus. Also tracheal cytotoxin that directly damages those ciliated cells, and that leads to that last phase where it can take weeks or months of healing. And then finally an endotoxin that leads to the production of those host cytokines. And again, the effect of the immune system can also cause some damage as well. And there is a whooping cough vaccine, so the pertussis vaccine. So that high vaccination has kept it pretty low in the United States. Current vaccines are an acellular formation. It's just the antigen. So again, it's impossible to get it from this. It's just injecting different markers from the bacteria, but it does require a booster every 11 after the age of 11. All right, our summary table here. So again, Bordetella pertussis causes whooping cough. It is caused or transmitted by droplet contact. Some of the virulence factors, that adhesion, antigen protein, and then a few toxins, so pertussis toxin, the tracheal cytotoxin, and endotoxin. There is a vaccine. It's part of the DTaP vaccine that is provided during as children. Also, the antibiotic azithromycin is added for contacts, and that is what is used to treat this. However, there is a concerning threat because it is becoming resistant. So it is on the list of CDC for those antibiotic resistance. Next, looking at RSV, or respiratory syncytial virus. This infects, again, the respiratory tract, causing these giant multinucleated cells. So it causes them to fuse together, and that's called a syncytia, hence the name respiratory syncytial virus. These outbreaks of droplets occur around the world, kind of peaks in the winter and early spring. Children are the most susceptible to this, especially 6 months and younger, as well as premature babies. They are the most at risk for this. However, in 2020, with COVID, there was those RSV infections were actually very low due to a lot of the measures put in place, again, wearing masks and those types of things to prevent COVID. There was actually a decrease in RSV as a result of that. However, then there was kind of an unusual wave of it in the summer of 2021 when those requirements and mandates were starting to be lifted. So again, not being required to wear a mask, social distancing, that type of thing, that RSV kind of spiked again, but now it's kind of returned to normal levels. Just a little bit more about some of the signs and symptoms. A fever for about 3 days, that rhinitis, throat infections, so pharyngitis, ear infections. However, in more serious infections, it progresses to the bronchial tree and the parenchyma, symptoms of croup, difficulty breathing, and abnormal breathing sounds can occur. Again, it is highly contagious, transmitted through those droplets. Also fomites, so again, door handles, inanimate objects. There is some passive antibody therapy that can be effective. So again, that's where somebody who has antibodies, those antibodies are injected into somebody with RSV, so transferring those antibodies through injection. But then also there is ribavirin that's available as an aerosol. Looking at our summary table, so again, this is caused by respiratory syncytial virus, spread by droplet and indirect contact. Again, the virulence is kind of in the name. It causes those syncytia. That's how it transfers. It just causes the cells to join together. Again, some prevention can be provided by those passive antibodies, but then the ribavirin can be used along with the antibodies as treatment. Next, looking at the flu or influenza, all of these are caused by one of three influenza viruses. So they're categorized by A, B, or C, and they all belong to the Orthomyxoviridae family. Again, some of the reasons to study the flu, again, the annual flu seasons have the potential to turn deadly for many people, especially those who are immunocompromised, elderly, or younger individuals. A lot of diseases, though, are termed the flu that are not, so like a really bad cold, even the stomach, just some vomiting. It's typically called the flu, but that just because somebody has a GI disturbance that lasts like a day doesn't mean they actually had the flu, but it's commonly referred to as that. But the behavior of the influenza virus shows us how viruses can become more serious than previously we understood. Some of the signs and symptoms, so headaches, chills, a dry cough, aches, fever, stuffy nose, sore throat, but extreme fatigue can last for a few days or weeks. So again, when somebody gets kind of a stomach bug or stomach virus and they're throwing up for a day, typically they call that a flu. But again, influenza causes this fatigue to last for multiple days or even weeks. It does, kind of like the common cold, makes them more vulnerable to secondary infections, especially pneumonia is one to watch for. Patients who have respiratory issues anyways, like emphysema or cardiopulmonary disease, again, along with those immunocompromised, the young, elderly, pregnant, are more susceptible to having serious complications with the flu. Just a schematic here of the influenza virus that is being shown here. A lot of things that we'll kind of mention are important in understanding how it works or with treatment or vaccines is hemagglutinin and neuraminidase. And neuraminidase is an enzyme that it makes. It is an enveloped virus and a negative sense RNA virus. So again, it just has RNA that is used. We'll talk more about the importance of that here in just a minute. Right, so again, these glycoproteins, the hemagglutinin H, this has agglutinating actions on the red blood cells. It binds to those host receptors of the respiratory mucosa. That's how it's able to get in. That neuraminidase, again, is an enzyme. It breaks down the protective mucus coating of the respiratory tract. That also helps with budding and release within the virus, and it causes host cell fusion. So again, cells to come together. That's how it spreads to the next one, is by that enzyme neuraminidase. Now, the mutations of the glycoproteins cause a couple things. One is antigenic drift. The other is antigenic shift. So antigenic drift is kind of just a gradual changing of the amino acid composition in the antigens over time. But both of these are going to cause our immune cells not to recognize previous infections. So it's this ability to constantly change or mutate. So antigenic drift is more gradual, just by kind of random mutations that occur that change the amino acid sequence. But again, that causes a decreased ability for those host memory cells to recognize it because it looks completely different. Whereas with antigenic shift, again, I mentioned this is an RNA virus. Well, it actually has 8 segments of RNA in it. So what happens with antigenic shift is there's a swapping out of one of those segments with another influenza virus. So if an individual becomes infected with 2 different types of influenza at the same time, during that maturing process, whenever the virus is being put together, they can actually swap some of those RNA segments, and it leads to different subtypes of the virus. We have new combinations now. And because the genome is now different, the proteins they produce is different. So now those host memory cells don't recognize it. Again, vaccines to one would not protect against the other. And this is often what causes pandemics of the flu, is whenever this antigenic shift happens, because there's no immunity. It's completely new virus that's out there. So it takes a while, just like with COVID, to build up that immunity. All right, this is just kind of showing that antigenic shift. So again, if in this case there's the duck influenza virus and the human influenza virus, essentially what happens, again, both of them have these 8 segments of RNA. If both of these would infect an organism at the same time, so here the example is this pig that would actually be infected with both types of viruses at the same time. Whenever the cell or whenever the virus is being put together, what happens is here the human influenza virus actually added one of the duck RNA viral particles instead of its. So it still has 8 RNA segments, but this one is completely new. So again, this can cause pandemics, or because now it has this completely different protein. It's not just a gradual change, but it's this whole new RNA segment that makes pretty different proteins that our immune system would not recognize. So some preventions of the flu, those 3 major types, there are vaccines against them. Again, but because there are so many different strains, it's impossible to completely vaccinate against it. So the 3 major types are included in the vaccine. It is an intramuscular inactivated vaccine that is being used. And then the vaccine, though, cannot cause the flu. Common misconception. Typically, it activates the immune system, so some people, have that immune response, so they may get a fever after being vaccinated, but that's actually the immune system, mounting a response to that, but they don't actually get the flu. So they're, again, continually researching those emerging strains as a way of trying to prevent any kind of pandemic, so mixing of those. So there are several kind of universal flu vaccines that are in clinical trials now, just trying to target parts of that hemagglutinin molecule that don't typically mutate. Again, because of antigenic drift, that gradual kind of changing, it makes it really hard to vaccinate. So kind of the goal right now is finding some part of the virus, some protein that is less likely to change or mutate over time. And that's what they're working on now. So our summary table, again, all caused by viruses, the influenza A, B, or C, but there are multiple subtypes under each of those, transmitted by droplets, direct or indirect contact. Again, those glycoprotein spikes allow them to attach, but then one of the biggest issues is their ability to mutate by antigenic drift or shift. Lots of vaccines that are available. It is required annually because of those mutations that are in there. A couple treatments include Tamiflu and Zofluza are commonly used. Most of those, though, the key is treating early in order for them to be effective.